Welcome everyone to PHM 601. Today's class is on social media and health consumerism. And there are three learning objectives for today. First, we're going to explain the role of consumerism and its impact on population health management, and talk about behavioral concepts with population health application, and then the kind of give you an opportunity to demonstrate understanding of the application of consumer behavior concepts, to population health applications. All right. So in the first learning objective, we'll be focusing on health consumerism. So, keeping patients or healthcare users involved really involves that they are able to actively make healthcare decisions for themselves. We are, in the era of patient-centered care. What this means is that we require our patients to basically have enough knowledge, information, agency, self-efficacy, and health literacy to be able to make informed decision and to have informed conversation with their care providers. If they are not having this informed conversation and really able to talk openly about what they know, and be really engaged in their health, or in their management of their illness or management of their condition. Anything else that we are doing is basically window dressing. So the consumerism is concerned with empowering patients, and this image here shows some suggestions on what we can do to accomplish this. You have correct information, you have understandable information, and then you want to have your patients have the confidence or the self-efficacy to be, feel that they are able to speak to the professional, and when the professional speaks to them, they have the confidence to believe that they will be able to do the things that they need to do to make their health better. So, the question you may want to ask is, does health consumer experience, does it differ from health, from patient experience? And the answer to that is yes. So consumer experience is concerned with the perception patients have about their interaction with the healthcare system. On the other hand, patient experience is focused on the interactions itself. I'm going to give you an example. If a healthcare provider, in designing the patient experience, has, placed a lot of uh, settings or materials so that the front desk staff is able, is welcoming to the patients by being very friendly, and they do this, design this in as a way of having good patient experience. Now, patients who then come into the front desk and leave thinking that all of this friendly looking smiley staff, it's not quite what matters to her as much as this staff being able to direct her to the doctor's office. So while the friendly staff had been the focus of the provider when they're designing the patient experience, the consumer's experience, kind of happened in a different way. So that would be consumer experience, being able to have a perception of the interactions that have been designed of the healthcare system. But however, consumer experience is quite subjective. This means that another patient can come through the front desk and think the smile from the staff was the warmest thing that's ever happened to her her entire day. So, having empowerment does not solely reside with healthcare providers. In fact, you could say that there are many factors that influence how a patient is empowered, and the medium by which this is heard is, kind of differs. Actually, these days, people are most likely going to get their information from the almighty Dr. Google. So, as you can see from the picture, this is a very hilarious one where the doctor is trying to explain how much his patients are relying on medical advice, WebMD being one of the one that very, very common, and coming into the conversation and telling, I've already diagnosed what it is that is wrong with me. You're, as good as a second opinion. So, information seeking, I'm going to talk a little bit about information seeking. So, a lot of information that happens and how patients get their health information does not only reside with the healthcare professional or the healthcare provider, like I said. You also have families and friends, having sharing a lot of health information. I'm going to use an example. In 2020, my mother got COVID, and this was back when it was raging all over the world. Before she was diagnosed, she had heard that you can prevent COVID by taking vitamin C and all of that concussions. So no matter what we said to her, she really basically wouldn't listen. And we were really pushing for her to be very careful and limit high interactions with people, and this was because she had diabetes, and being diabetic is a high risk population. So we were kind of trying to get her not to go to work. As you can imagine, she would rather take her concussions than not going to work. And she believed her friends that were telling her, "Oh, the vitamin C thing works," rather than my sister and I are healthcare professionals, so we had that information, but she would rather take the advice of her friends rather than listen to us. So this is basically how that is with, unfortunately, healthcare information. So regardless, regardless of how, as healthcare professionals, we know that there are a lot of ways, and sometimes not. Ways that we know that are trustworthy or relevant, even though we know there are many ways that patients are getting their health information. Healthcare providers, we are still taxed to weed out through the noise and find a way to get the right information across to our patients. So making information trustworthy and available is, some of the things that is terribly important. So when you hear availability, it does not necessarily mean that the information exists. Availability goes beyond that. Let me use an example of, a healthcare provider spends a lot of money designing the perfect pamphlet. However, this pamphlet is full of medical jargon. So technically, that information exists, but that information is not available. That being because of the way that the language of the information was used. And then, for example, if you have a way of communicating with patients, and this way is only through the internet, what you have basically done is excluding older, less technological savvy patients. So that is something to bear in mind. So this is not to say that digital form of health communication is not crucial. It is very much so. As you can see from the image here on the slide, 54% of the sampled patients in this study said that they're likely to send digital photos of skin problems to their dermatologist. And you see, on the other hand, only 48% of clinicians said that they were comfortable with relying on DIY diagnostics, in order to prescribe medication, which as healthcare professionals, we can understand why that is. So, this now takes us to learning objective two, and in this learning objective, we'll basically be talking about social marketing. So this diagram that we see on the slide is showing a consumer decision making process. You have it goes from health issue recognition to purchase or making a choice to post evaluation. So basically, if you have a look at this, you see that much of what is happening in terms of decision making is kind of happening outside direct involvement of the healthcare professionals. So this is another example to show why empowering patients is really important. So, social marketing, you may have heard this term before, or perhaps you're more familiar with the term marketing. So, the American Marketing Association defines marketing as activities, and this includes a set of institutions and processes that is basically focused on creating, communicating, delivering, and exchanging offerings. So this is the definition of marketing. So how does marketing differ from how does social marketing differ from the traditional marketing that we know? Social marketing is rather more altruistic. I don't know if I'm pronouncing it well. So you have, the idea of doing good, the greater good, be a cloud that is around them. An example that I can think of social marketing is from my experience when I was working in Nigeria. So there was this organization that I worked with that sold contraceptives. However, their marketing strategy focused less on telling people to purchase the product. Instead, they were they leaned more towards teaching people about contraceptives, and in this way they were doing good. And if in the process of doing good, they are able to sell a couple of contraceptives, that's work well done. So, social marketing, is really something that comes handy. Sorry, social media is something that comes handy for social marketing, especially since everybody is on social media platform, on one social media platform or the other. Social media is pretty good in engaging other players in the game, influencers. Pretty sure you've heard those terms before. Influencers who know, for an example, who know how to sell without it looking like they are selling. However, social media, comes with the problem of misinformation. COVID-19 was rife with it. I can just remember in 2020, it was crazy. I kind of always wondered if it was fear that drove the frenzy of inaccurate information, some of which were just bonkers. And I also think, this is my personal opinion, that the politicizing of the pandemic also didn't help. Anyway, as you can see, the definition of misinformation is health-related claim that is currently false due to lack of scientific evidence. I think I've mentioned this in a previous module, but when it comes to scientific evidence, or the weights at which evidence bears when it comes to in the science world, scientific research takes precedence over anecdotal accounts. So when people are pushing anecdotal evidence, it's not seen as being scientific. And in a way, it really does muddy the waters. So that is one of the reasons why it doesn't do so. So anecdotal can be quite contextual, and with scientific research, you're really able to go more into things, and having to using the biases that we go into with scientific research, and accounting for confounders. It kind of cleans up that water in a way that anecdotal evidence does not. Anyway, so misinformation is different from disinformation. Disinformation is, where one is actively intended to spread false information, and so the person who is spreading it, or the people who are spreading it, know that it's false. However, they are, pushing it nevertheless. So, and a lot of that happened during COVID as well. So now we are going to talk about patient-generated data. As you may know, in the world of digital health, there are multiple sources of health data, one of which are wearables. So wearables is quite a hot topic of late. So when they started, I can remember way back in the day, the wearables were geared more towards physical fitness, but these days it's beginning to feel like a mini laboratory. I have my Apple Watch collects information about my ECGs, collecting information about my oxygen levels, collecting information about my heart rate. Actually, recently my phone, included this feature where it was asking me to contribute to health research, which was I haven't signed up for it, because I was like, oh, really? This is a lot. This is interesting. And then you have my son's physician who just emailed me, and he's asking me to send him a screenshot of my son's vaccination record, which was from his previous doctor when we lived in St. Louis, Missouri. So he's asking for a screenshot because for some reason the system, the system in North Oaks is not speaking to the system in the hospital in Missouri. So that's a very interesting way that we're using digital health. However, unfortunately, not everybody in the world is experiencing this advancement in digital health and digital technology. So as you can see from this image, it says North America is contributing, or is really outperforming all other regions in the world as it regards the wearable technology. And so this then mean that even if there are physicians, particularly outside, in regions where you don't have wearables, being able to, use it in the way that we're using it in North America, a lot of that is because these areas lack the infrastructure to make it happen. So, for those who can utilize the opportunities digital health provides, on the screen you see, scenarios that is giving examples of how it can be done. You can pause the video at this point so that you're able to review the images. So, this is the last learning objectives, and in it we are going to be exploring the application of behavioral concepts. So, behavioral economics, which you may or may not have heard about, is an area of health that studies the hows and the whys of health behavior, and this is specifically related to purchasing of healthcare products or services. So there are a number of approaches that we use with behavioral economics, to answer those questions of the whys and the hows. One of the popular ones is choice architecture. So, and at the center of choice architecture is the use of nudge techniques to direct consumers towards what is seen as a desired choice. I provided a number of videos on the assigned viewing that really talks about nudge techniques, and you could watch that. I highly recommend that you do, so that you get a very good understanding of what that is. So the idea of nudge essentially is to make it easier for people to make what is considered to be the right choices or the right decision, and it does this by subtly pointing them towards what is whatever has been seen as the right choices. An example would be the function that Fitbit has, whereby you have fireworks when the wearers reach 10,000 steps. And another example, and this comes from Apple Watch, is that it has this fitness tracker that tells you how many steps you've taken, how many calories you've burned, and how long you have been sitting. So this type of features, what it basically does is kind of monitors your behavior, so that because you're so very conscious of it, you would, when you see yourself doing, let's say, 500 steps as against 10,000, you feel that, oh, I have not done what I needed to do today. And maybe the next day, or whenever you have time, there's that kind of thing in your head that is telling you to catch up, to that to that goal. So that is an example of a nudge technique. So what I want you guys to do here is to consider the following, this population health management applications, and read through that, and really review it, and then think up of what kind of nudge technique that can possibly be used to achieve these applications. So that's that for today. Remember to use the Q&A board if you have any questions, on anything that has been covered in this module. And do have a lovely day.